Obsessive-compulsive disorder (OCD) in babies. Obsessive-compulsive disorder (OCD) is a mental health condition characterized by intrusive thoughts, obsessions, and repetitive behaviors or mental acts, compulsions aimed at reducing distress. While OCD is typically diagnosed in older children, adolescents, or adults, it is extremely rare in infancy. However, certain behaviors in babies might mimic OCD-like patterns or signal developmental concerns. OCD in infancy. Is it possible? Babies do not have the cognitive development to experience true obsessions or compulsions as defined in OCD. However, some behaviors may resemble OCD traits or indicate potential risks for the condition later in life. Behaviors in babies often mistaken for OCD. Repetitive actions. Babies naturally engage in repetitive behaviors like clapping, rocking, or sucking their thumb, which are part of normal development. Sensitivity to routine. A strong preference for routines or predictable patterns is typical in infancy and does not indicate OCD. Attachment to objects. Babies may become fixated on a favorite toy or blanket, which is normal and comforting. These behaviors are developmentally appropriate and not a sign of OCD unless they persist into later childhood and interfere with daily life. Red flags for future concerns. OCD itself cannot be diagnosed in babies. Certain factors may increase the likelihood of developing OCD later. 1. Family history. A genetic predisposition to OCD or related anxiety disorders. 2. Temperament. A highly anxious or perfectionistic temperament in early childhood. 3. Prenatal or perinatal factors. Stress, infection, or complications during pregnancy may contribute to later neurodevelopmental challenges. 4. Delayed development. Significant delays in motor, social, or cognitive milestones. Diagnosis. OCD is not diagnosed in infancy. If obsessive-compulsive traits are suspected, they typically emerge in early childhood ages 3 to 6. Diagnosis involves psychological evaluation by a mental health professional. Management for at-risk babies. If there are developmental or behavioral concerns, the following steps can provide support. 1. Early intervention services. Address developmental delays or sensory sensitivities. 2. Parental support. Learn strategies to create a calm and structured environment. 3. Regular monitoring. Follow up with pediatricians or child psychologists for ongoing evaluation. Prognosis. Most repetitive behaviors in babies are normal and temporary. If OCD develops later, early identification and cognitive behavioral therapy (CBT) can help manage symptoms effectively. For now, fostering a supportive and nurturing environment is the best approach. If you are concerned about your baby's behaviors or family history of OCD, consult your pediatrician or a developmental specialist for guidance.